CEO today. Joining us now, David Grayson, founder and CEO of CareMed EMS. Good morning, David. Thanks so much for joining us today.
Good morning. Thanks for having me.
You bet. So this is a company that you founded. You're the founder and presently serve as the CEO of the company. Tell us a little bit about the company, exactly what you guys do.
Sir, I started CareMed about 5 years ago in Oxford, and we provide ambulance coverage for 5 counties now currently in Mississippi. So when you dial 911, we're the ones that come in those counties. We also provide non-emergency medical transportation for ambulance patients throughout Mississippi.
Yeah, so how do you handle the rural areas? I know living in a more metropolitan area, we don't think that much about it. Their ambulances are pervasive, and 911 services are available, and there are multiple law enforcement and emergency medical service agencies and so forth. You just don't, I guess, concern yourself with it. But when you're in a rural area and you're far removed from all of those resources and assets, how do you deal with that?
Right, rural areas are a challenge in Mississippi, especially with the loss of rural hospitals and rural emergency rooms. When we pick those patients up, they end up having to travel to adjoining counties or sometimes adjoining states to find a hospital that they can go to. Rural areas have, routinely, their response times are going to be longer. The patients are going to generally be sicker. And when we're on those calls, many times that takes the resources out of that county, so there's nobody to respond. And that kind of leads us to the shortage of paramedics and EMTs in Mississippi.
Yeah, and of course the time delays and just the time required for pickup, transport, and so forth. I mean, that could actually enter in or factor into the patient's health condition and their recoverability, even survivability, I would assume.
Yes, sir, they absolutely could. As I said, many of these rural patients are oftentimes sicker. It takes longer for us to get to them to help them and longer time to transport them. Many times our paramedics are with those patients for maybe a couple of hours before they get to a hospital.
So how has the pandemic figured into the situation? I assume that you guys are also challenged with the shortage of labor, which is affecting, it seems, like every industry in the country.
Right. Before the pandemic, we already were experiencing a shortage of EMTs and paramedics, much like other parts of healthcare. The pandemic has only made it worse. We have less people than we need being educated as EMTs and paramedics on top of that. There's a bigger demand than there ever was for EMTs and paramedics right now. Obviously, during the pandemic, we were called on to treat a lot of these patients, transport them, and it has exacerbated the problem as far as the shortage of EMTs and paramedics to the point that we're getting into a crisis. We're going to get to a point where the shortage is so bad, as it is in some other parts of the country, that there may not always be ambulances to come when you call.
Yeah, which means loss of life potentially, and certainly a more difficult health situation to deal with. Injuries involved. I mean, the whole gambit. Just kind of a range of thoughts run through my head when I think about certain situations that require immediate attention, EMS, and they're not available. What are the results of that? What are the consequences? And most of the time, none of those are good, and that's concerning. And then you got the cost. This is an expensive service, and you guys, to a great extent, are reimbursed by insurance. Is that correct?
That's right. Our costs are going up every year, as everybody else's is with inflation. Of course, the cost of health care is just soaring. Cost of our equipment is, and paying our people. Our reimbursements, we primarily are reimbursed by Medicare and Medicaid, is our largest reimbursers. Those rates are set by Congress and our state officials at the Medicaid level. We haven't seen a significant increase in reimbursement in some time now. Medicaid patients, we're often asked, well, every time we transport a Medicaid patient, we're transporting them at below the cost. We get reimbursed less
Right.
money than it takes us to provide that trip.
Yeah. And then what about the uninsured population, which is quite high here in the state of Mississippi?
Right, it's very high. And EMS, as you know, when you call 911, we don't ask for your insurance, right? We have to
Right.
come. We take care
Right.
of you no matter what. So there's a large number of uninsured in Mississippi. And that's a challenge for us as well. Of course, we generally don't get reimbursed for those. So that even taxes the system worse from a reimbursement level. And our people are out there working hard, and they deserve good equipment and good pay raises. And we really need our government officials, we really need their help to step up and help us improve our reimbursements and get us at least reimbursed at least come somewhere closer to what our cost of doing business is, so we can make sure that people do get an ambulance when they call 911.
What happens, David, when you respond to a call and you provide some level of care, and then the patient says that they don't want to go to an ER, to a hospital, to a healthcare facility? How does that work from a financial perspective?
Right. And that happened a lot during COVID, because you would go treat people and they didn't really want to go to a hospital full of COVID, right? In our current reimbursement models, Medicare, Medicaid, and almost all insurances, we get paid when we transport you to the hospital. So if we go out and provide you care at your home or beside the road or wherever, and you do not get transported, we generally did that. We did that at our cost. There's no reimbursement for that.
Yeah.
That's another area that we really need to change in healthcare.
Interesting. So, is the industry doing anything to try to entice people to enter this line of work so that you can get more human resources involved in it?
We have a lot of companies provide scholarships for people, for example, that want to become EMTs and paramedics. In Mississippi, most all of our EMTs and paramedics are educated through the community college system. Of course, they try to recruit people into these classes. Unfortunately, we're kind of, I don't know that we've done enough to educate people to know that it's actually a really good occupation, well-paid occupation. I think a lot of people may be going into other healthcare areas than EMS. Right now in Mississippi, our community college programs have a fairly low number of students going into EMS, nowhere near enough to meet the needs that we need today. There is probably every ambulance service in Mississippi is short-staffed right now, some more significant than others. And that is just due to lack of people.
David, is there anything that you'd like to see our state government, our legislature and governor, et cetera, act on to help the industry?
I would. I think the one thing we need a lot of help from in Mississippi is from the Medicaid, the Mississippi Division of Medicaid. We need to improve our reimbursement for those patients. An example for those Medicaid patients, we do not get paid for the first 25 miles of a transport for Medicaid patients. That just makes it worse. There's some other things they could do to help us get to more reasonable reimbursements for transporting and treating these patients. I know that the state we did get a little bit of an allotment of the COVID money, the first allotment. We haven't got anything since then. That would help to make us whole, because, the EMS folks are the front line. They're out there going every day. People expect an ambulance to show up when they call, and we really need our state government, our state leaders, and even our federal leaders to pay us some attention, I guess. Healthcare is a big industry. We hear a lot about nurses and doctors and hospitals. We don't hear a lot about it. We really need to bring that to our attention, and it's critical.
Yeah, you're right about that. It doesn't seem to make its way into the talking points whenever we discuss healthcare. David, thanks so much for coming on. And thanks for your services and for setting up shop in that area where need is critical and desperately needed. Appreciate that, David. Take care.